Your face. Have you ever taken an honest look at your face in the mirror? Surprising health symptoms literally may be staring you in the face. Your eyes, your nose, your skin. Well, today's show is all about the health secrets your face can reveal, and it all starts right now.
Eyes, nose, mouth.
The health secrets your face can reveal.
Lips, skin, tongue.
What to look for when you look in the mirror.
Your eyes do reveal a lot about your overall health.
Pink, itchy, red.
It's actually a symptom of something much more serious going on.
And the 3-day rule that can save your life.
You really look at your lips when the lipstick isn't on?
Not really.
So after this, you'll look.
What your face is telling you.
This is a true medical emergency.
Today on The Doctors, we're changing every body, one body at a time. Before the break, we ask you what it means when your eyebrows go from this to this. Is it a sign of A, a skin condition, B, an infection, or C, a hormone problem? The answer is C, a hormone problem.
If you lose the outer third of your eyebrow, it can be a sign of hypothyroidism. As a result, you may feel fatigued, constipated, cold, and sometimes even depressed or forgetful. You may also have a hard time losing weight. Ask your doctor for a thyroid test. If something's off, medication may get you back on track.
Thank you, Dr. Lisa. And from the shape of your eyebrows to the color of your lips, today we're showing you the health secrets your face can reveal. And let's spill some secrets, starting with... We're talking about your eyes, and you've all heard they're the window to your soul, but they also can be a window to your health. And here to help us out, talking about the eyes, is optometrist Dr. Elise Briscoe. Thank you, Elise, for being here. And I'm going to start off with the most common of complaints. Clap your hands if you've ever had red eyes. We've all been there, and sometimes it's just, I've had a long day at work, or I haven't had enough sleep. But chronic red eyes can also be a sign of something much more serious.
Yeah, absolutely. You know, there's a lot more than meets the eye to an eye exam. As an optometrist, I examine for more than do you just need contact lenses or glasses, because your eyes do reveal a lot about your overall health.
You bring up a great point, because a lot of patients will present with eye problems, but it's actually a sign or a symptom of something much more serious going on beyond, for instance, here, just a red eye.
Right.
Because the red eye could mean something is wrong with you, or you're not treating your eyes correctly. And a lot of people, what they'll do is they'll just constantly put drops in their eyes and, oh, you know what? I can deal with this. I can live with this. And little do they know.
Well, if your eyes are persistently red, it could mean a health problem. Or it could even mean that your eyes are getting infected and irritated by using old makeup. Every 6 months, you should change your eyeliner and mascara. And also, ladies, and maybe even a few gentlemen, don't share makeup with your friends. And don't...
I'm starting today.
No more sharing.
Jim, we'll never share our mascara ever again.
Done.
Thank you.
And don't keep your makeup in your pocket, your purse, or your car, because the heat can destroy the preservatives that prevents bacteria from growing in the mascara.
Good point. Yeah.
And so the other thing with red eyes, common issues that we find people using the eye drops over and over again. But unfortunately, if you do that, you can get the rebound effect if you ever stop using them, because your eyes get so used to it. So that's a temporary fix.
Right. Well, I see that a lot in my practice because I take care of a lot of celebrities and actors and actresses, and they're using the red eye drops to keep their eyes looking more white in front of the camera. But the problem is they may be masking an underlying health problem. So the general rule is if your eyes are red for more than 3 days, go and see your optometrist or ophthalmologist.
I love that rule.
Yeah.
3 days. Well, let's move on down, because Dr. Jim, when you get red eyes or even pink eyes, sometimes the question is it an infection? Is it something different?
Else.
So how do you know as a mom?
It's really important, because conjunctivitis or pink eye is pretty common. About 10% of kids will get that throughout their childhood. So, but if it's, you know, just because they have goop in their eye doesn't mean it's an infection. A lot of times kids will just have something like this, basically morning mucus, eye boogers, or there's a medical term for it, rheum. Basically, it's kind of solidified tears that have been there overnight. They get all mucousy, a little bit crusty maybe, and one of the keys to this is, you see, there's no redness in the eye, all right? And if you were to go and wipe this mucus away, it wouldn't come back until the next day.
Okay.
The next morning. When those are the two keys to know it's just eye boogers. Now, if it's pink eye or an infection, you see you're going to have a lot more goop. It's going to be a little thicker, and it's often yellow or greenish. And there's obviously the redness, a little bit of redness in the whites of their eye. And then you go to wipe away this goop, an hour later, it's back. That's the sign that it's conjunctivitis, time to see the doctor.
And I always tell my parents, too, that it looks kind of like tapioca or vanilla pudding, the discharge that you get. But, you know, it's really, really contagious, and that's the main takeaway point from this. Yep. In fact, if I see one child in my practice, usually several of their classmates will come in also with an eye infection, and then their parents get it, and sometimes even their pets get it. So if you suspect that your child has an eye infection, keep them home from school so they don't spread it to everybody.
Biggest thing, yeah.
And then a couple of tips to minimize getting a bacterial conjunctivitis is teach your children not to wipe their eyes after they wipe their nose. Do you see your kids doing that?
Oh, yeah, all the time.
Yeah, because I have a 2-year-old and he's always doing this and then he rubs his eyes. And wear swim goggles while you're swimming, so in case the pool is contaminated, you don't get an infection. And then if your doctor prescribes antibiotic drops for it, make sure you take it for the full 7 days, because otherwise, if your eyes look great in 2 days, but you still have a little bit of bacteria left, it comes back stronger and resistant to the antibiotic, because you didn't get rid of it all in the first place.
And while it's getting better, a nice warm compress to the eye can help ease the swelling and get rid of some of that mucus.
And contacts are so common nowadays. Would you not agree? This eye and the very first one over there where there's a lot of the redness, that whether it's from irritation or other things, be a good time to take a break from your contacts, use your glasses, because I've seen people who'll have this type of picture clinically and they're still wearing their contacts because they don't like how they look in their glasses. But you've got to take the contacts out, because all you're going to do is when you put them back in after this, reinfect yourself.
And you know what? If your eye's red, but just red in one area instead of the whole eye, then it could indicate a whole host of other problems. There's something called episcleritis, which could mean that you have rheumatoid arthritis. So you have red eyes, but you really have rheumatoid arthritis. Or you could have lupus, and in women it could mean hormonal changes or even irritable bowel syndrome.
Let's move on. I love your 3-day rule, because anything longer could be a sign of a more serious health condition. Let's talk about one last condition that your eyes can really show you and be the window to your soul or health problem. Because what I'm showing you right now is, believe it or not, cholesterol buildup in the eye. And if you're someone who eats a fatty diet, maybe you're getting up there in years and you've done this traditionally, what you're looking at here in this animation is the buildup of cholesterol in your bloodstream. We've all heard of cholesterol plaques, but what a lot of people don't realize is those same blood vessels travel to your eye, into your eyeball, and you can get cholesterol deposits throughout your eye, and that's what you're seeing here. A lot of times they'll start at 6 o'clock or 12 o'clock, but you can develop an actual ring around the eye of cholesterol deposits, and this can be a sign you've got to go get your blood cholesterol levels checked and work on getting them lowered through diet, exercise, and maybe even medications.
Yeah. And you know what? It's a problem. If I see this ring around the eye, that white ring, in only one eye, it could indicate that there's an arterial blockage in the other eye, which would place you at an increased risk for stroke. So whenever I see this ring around in a patient's eyes, I always say, have a physical exam and get your cholesterol checked. And I'll tell you, in my whole career, there's only been twice where a patient didn't follow this advice, and they both ended up having a stroke. And it's really sad because it could have been prevented. This is a warning sign that there's a possible health problem.
These are actually different cholesterol deposits under the skin of your eyelids. These can occur in people who don't have cholesterol problems, but certainly if you have these, another reason to make sure your cholesterol levels are okay in your bloodstream.
And those don't wipe away. It's not mucus.
Yeah, these are here to stay. Those are deposits underneath your skin. Here's the take home. You don't need to know what all these signs are necessarily, but you do need to get to your doctor if you're suffering from any of those. Thank you so much for sharing your tips with us today.
My pleasure.
Up next, the surprising health symptoms your mouth can reveal.